Wallin.
Thank you, Senator Dagenet and ministers. This delay proposed by Bill C-39 has for many, I think, obviously created an opening to attempt to re-litigate access to MAID for others, for those who are not suffering from a mental illness. Do you have a plan? Will you be more public? Will you be more proactive in support of MAID? What assurances can you offer the public that the delay proposed by Bill 39 will not impact access for the hundreds upon hundreds who are waiting for a clear signal?
Monsieur le Ministre. Minister.
Thank you for the question. I would add to the earlier question the fact that there are some experts that believe that we could have moved this March with the extension that was passed 2 years ago. But again, because of the prudence that my colleague alluded to, because of the fact that we just received a few weeks ago the report from the Parliamentary Committee on MAID, because of the fact that we want to give more time for people to access the curriculum, which will be completed. It's already in a good draft format. It will be completed in 2023. We also want the standards of practice to be well known and well accessible. These standards will be available in the next few weeks. We want the regulation and the information that will come increasingly with those regulations to be increasingly available. So we thought that 1 more year would be appropriate. But that is correct. It is work in progress. There are people that are suffering, have been suffering for many, many years, that are listening to us now and that feel probably challenged by the fact that this is not moving as quickly as some certainly would have liked that to happen.
Senator Wallin.
If I might add, Senator Wallin, again, I agree with you, and I agree with, thank you for your work, first of all, on this file. I agree with you that there are a number of people who will be disappointed by this, but we do feel it is the prudent way forward. We're not backing down on anything else. The statistics that are beginning to be generated are showing that the vast majority of cases are end of life. I think the statistic that I saw was 500 non-end of life cases out of 10,000. That's a fraction of a percentage point. And so with better data, with disaggregated data, I think we will be able to assure Canadians who might be skeptical about MAID and who might be prone otherwise to listening to disinformation, that what is really the case is empowering the autonomy of people to live with dignity and die with dignity under certain circumstances and conditions. And this is only a 1-year delay. We're not backing down on anything else.
Senator Wallin.
Well, just a small point on the COVID point that you raised. One of the things, rather than suggesting it was reason for delay, in fact, COVID allowed the system to open up so that people could use technology to communicate with one another. Can you ensure that that kind of access for people looking for advice, for guidance, or for MAID assessors to begin that process can continue to use technology?
Monsieur le Ministre.
Yes, there has been significant progress in COVID-19. Obviously, COVID-19 came with, I don't want to suggest that COVID-19 was good. Obviously, it came with enormous damage to our healthcare workers, patients who've been waiting for years for surgeries and diagnostics. But perhaps one good thing was, as you noted, a significant increase in access to virtual care, the use of digital health, also technologies to improve the quality and the safety of care. And we believe that access to information overall and access to technologies in particular will indeed be supportive of all sorts of care, including palliative care, home care, community care, access to medical aid in dying, fundamentally primary care, which is the weak cornerstone of our healthcare system now in Canada.
Senator Wallin, you still have 2.5 minutes.
Oh, I didn't realize the time had gone. I would like to just come back to the notion that I raised initially about a campaign, and we've had this discussion in the past that, and every caregiver, every MAID assessor, people who deal with the issue of mental illness in particular, but not exclusively, have said we need to have a much more public debate about this. And others have suggested that the government has been less than proactive, has been less than outspoken on this issue. And I guess I will just come back to that, which is, could we see more leadership on this issue from ministers such as the two here today, but the government in general?
Monsieur le Ministre.
I would say, Senator, thank you. I think that point is well taken, and I share some of those thoughts, and I'm working with Minister Duclos, but also I see Deputy Minister Lucas behind me, working with the information and working with these people. I think we will accomplish that. But thank you.
You still have 1 minute.
I will forfeit my time. Thank you.